training unit, and this time we're going to be learning this structure right here that consists of two hip bones, which we will focus on this tutorial, keep in mind. And another two elements or two bones are the sacrum, this bone that you can see right here, which we will talk about in a different tutorial and also a different training unit. But as you can see, this is also part of what is known as the bony pelvis. And let's say the fourth element, since we have four in total, will be the coccyx. And the coccyx is this bone here joining the tip of the sacrum. And we're also going to talk about it in a different tutorial and training unit. But now we're going to be focusing, like I said, on the hip bone. Very important. And the very first thing you need to know about the hip bone is also comprised of three bones. Three bones, or the hip bone consists of three bones. The first one is this one that you can see here. It's highlighted in green, like all our training units and all our tutorials. So you have a similar process, learning process. And this bone right here is the largest one that you find on the hip bone and is known as the ilium. Now the second one is this one here, also highlighted, and this is known as the ischium or ischium. You can pronounce it both ways. I've heard it both ways, so I think it's accepted as both ways. Now the third bone is this one here, very famous, I would say, bone. It's known as the pubic bone. Now that I just briefly introduced the three main components of the hip bone, it is time for us to talk about a structure where they all meet, and this is known as the acetabulum. Now the acetabulum, as I mentioned, is a cavity formed by the synostosis of these three bones. So this is the meeting point of these three bones: the ilium, the pubic bone, and of course the ischium. Now, still on the acetabulum, I want to add something important here, that this is the socket for the hip joint. So this serves as the socket point or the socket attachment, let's say, for the hip joint. As you know, the hip joint is a ball and socket joint. And for that matter, you're going to have a ball portion that is the head of the femur, as you can see here. And of course, the socket portion where this head will attach will then be the acetabulum. And this is, of course, for me, one of the most important joints of the human body. Now, moving on, I want to talk about the bones of the hip bone. And the first one, you probably guessed, this is the ilium. And the ilium is divided into two parts, the body and the wing. Now the wing is this flat shaped portion here that does look like a wing, and that's why we call it. We simplify things in anatomy. Now the body is the central part of the ilium that is located near the acetabulum. So this portion right here. And it is also part of the iliac portion of the acetabulum, like we talked about on the previous slides. Now, moving on to the different elements that we find within the structure that we need to talk about is known as the iliac crest. And this is the superior border of the wing of the ilium. And as you can see here on this image, it's stretching from this spine here, known as the anterior superior iliac spine. And then it's stretching all the way to the posterior part to another spine known as the posterior superior iliac spine. Now, important thing about the iliac crest is that it serves as an origin and insertion point for certain muscles. Very important thing. So it's an attachment point for muscles, including a very important one that you know, and is a very important and large muscle of your body known as the latissimus dorsi. One important thing about the ilium is that it has four different spines located in four different positions within the ilium. Now, the first one is the one that you see here. This is known, and as I already talked about, this is the anterior superior iliac spine. and it is a bony projection that marks the anterior limit of the iliac crest, like I also talked about on the previous slides. And it is the origin for the sartorius muscle. Then is known as the anterior inferior iliac spine, and this is a bony process at the anterior margin of the ilium. Now this serves as the origin points for the rectus femoris muscle. Now moving on to the last spine that you find within of the hip bone, this time is the pubic bone. And the pubic bone is known to have three main structures: the body, the superior ramus, and the inferior ramus. Now the superior ramus is this portion right here that you can see here that is located just above the obturator foramen, which is this large opening here that we will also briefly talk about later on. But this is where you find the superior ramus. Now, of course, the inferior ramus will be this portion right here, that it is between the symphysis and the suture line with the ischium, which we will talk about as well later on. Like I promised, let's start then with the obturator foramen, this large opening that you find here between the pubis and the ischium. Now this is really important to mention, especially on this tutorial, because this is where a lot of nerves, important nerves and blood vessels will pass through. So this is a very important foramen in your body. Now the other structure that you find within the pubic bone is known as the symphysial surface. Now this is a surface of the superior ramus of the pubis that will, or the pubic bone, that will unite with the opposite surface through a midline cartilaginous joint, forming this structure right here that you can see on this image. This is known as the pubic symphysis or the symphysis pubis, adding the name right here. So this structure is very important as well. And of course, the participating structure of the pubic bone will be the symphysial surface. This is the ischium. Now the ischium is also divided into two portions, the body and the ramus. And the body is this portion right here, located just behind the obturator foramen. This is the obturator foramen, like we talked about, this large opening. Now the ramus of the ischium is going to be found right here, just below the obturator foramen. On to another structure of the ischium, this time the ischial spine or ischial spine. And the ischial spine is a bony prominence, as you can see here, between two sciatic notches. The greater sciatic notch right here and the lesser sciatic notch. And this is the ischial spine just in between those two notches. Now, important structure because it serves as an attachment point for some muscles, including this one that I'm showing you right here, this one highlighted in green. And you can see clearly it attaching to the ischial spine or the ischial spine. Since we've been talking about these structures, it makes sense to talk about them in a little bit more detail now. And let's start, of course, with a greater sciatic notch. And this is a large notch that you find between the posterior inferior iliac spine right here and goes all the way down to the ischial spine that we talked about previously. Now, an important thing that you need to know is that another structure, the last structure of the ischium, this is the tuberosity of the ischium, and this is a ischial or ischial process at the lower end of the lesser sciatic notch. Like I mentioned before here, the lesser sciatic notch will extend up to the tuberosity of the ischium, and of course this is the structure that we are highlighting right now. Now that we just finished talking about all the bony elements that we find on the hip joint, it is time to move on to another bone, this time located a little bit further down, and this is the femur. Now the femur is the largest tubular bone that you find on your body, and it's also known as a thigh bone. And in terms of elements, let's start with the very first one. It is known as the head of the femur. And I already talked a little bit about this element. And what you need to know is this is the ball part of the ball and socket hip joint. Now this is going to be articulating with this portion here of the hip joint known as the acetabulum. Very important part. Now another part that I want to highlight on the head of the femur is this depression right here that is used for the attachment of this ligament that is cut right here. This is the head of the femur ligament. And this is a very important ligament because this helps the connection between the two bones, helps strengthen this connection. Now moving on to another part, the largest portion of the femur. This is known, of course, as the body or the shaft of the femur. Moving on to the next one, this time we're going to talk about the neck of the femur. And this is the portion that you find between the head right here and this other portion that we're going to talk about next, known as the greater trochanter. And as I promised, moving on to the greater trochanter, this is a large prominence on the superior lateral aspect of the femur shaft. And is used for several things, especially attachment of different muscles, including the gluteus medius that you can find here on this image. It is attaching here to this greater trochanter. And also others like the gluteus minimus and the piriformis muscles. If you have a greater trochanter, you have to have, of course, a lesser trochanter. And the lesser trochanter is a small prominence that you find on the posterior medial aspect of the proximal femur shaft. And it serves as an attachment to a very important muscle known as the iliopsoas muscle. Now, between the two trochanters, you find a line. This line is known as the linea aspera. In Latin, this means rough line, and it is indeed a rough double line on the posterior aspect of the femur. And this is an important line because it serves as insertion and attachment points for many muscles, including the gluteus maximus. As you can see here, the gluteus maximus is inserting as well on the linea aspera. Now, the next structures that we need to cover on the femur are these that you find on the distal portion of this bone. Right here, you have a lateral one and also a medial one, and these are called the condyles. So you have a medial condyle of the femur and a lateral condyle. And between these two structures, there is another structure known as the intercondylar fossa, as you can see here. Hello everyone, this is João. Welcome to kenhub.com, where learning anatomy becomes easy. Today I'm going to be covering the humerus and also later on this tutorial, the scapula. Now, what I'm going to be doing on this tutorial and the future tutorials is I'm going to be giving you the terms in English, but right after it, I'm going to show you how you do it in Latin, how you will use the Latin terminology to refer to these structures, because as you know, Latin is the universal language of anatomy. Now let's start, and the first thing that I need to pinpoint are the articulations that are happening between the humerus and other bones. And proximally, you can see that the humerus is articulating with this triangle-shaped bone here, known as the scapula. And distally, it is articulating with the ulna and with the radius. So we are looking at the anterior view of the humerus, and the first structure that you can clearly see here is the head of the humerus, and I'm highlighting it so you can see that it's articulating here with the glenoid cavity of the scapula. Now laterally you can see this prominence known as the greater tubercle, and medially, you'll find another prominence, a smaller one, known as the lesser tubercle. Now, as you can see, intertubercular sulcus. And it's also known as the bicipital groove. And it's known as the bicipital groove because this is where the long head of the biceps brachii, the muscle, biceps brachii will go through. And I want to show you. So this is the muscle, and the long head is going through this intertubercular groove or sulcus. If we move distally, we're going to find here a tuberosity, and this is known as the deltoid tuberosity. And as the name indicates, this is where the deltoid muscle is going to insert. So you have here an image of the deltoid muscle, and it's using the deltoid tuberosity on the humerus to insert. Now moving further to a more distal point, you're going to find a fossa here known as the radial fossa, and it's located laterally. Now on the medial side, you're going to find what it's known as the coronoid fossa. Now here you will also find a structure that is known as the, I'm going to change the color here, this is known as the capitulum, and this is what's going to articulate, the structure is going to articulate with the radius. And on the opposite side, medially to it, you're going to find another structure known as the trochlea, and this is what's going to articulate with the ulna. We are now looking at a posterior view of the humerus, where you can still see the clavicle here and the scapula also on their posterior views. And the first structure that we also saw on the anterior view was the head of the humerus, so you can still see it here. Now a little bit more laterally or more distally, you're going to find another important structure right here, known as the anatomical neck. Now, a bit further laterally, you're going to find the greater tubercle that you could also see on the interior view. More distally, you're going to find another neck known as the surgical neck. And you can notice here a groove or the deltoid tuberosity here laterally, where the deltoid muscle is going to insert. And a very important thing that I need to clarify here, and I forgot to mention on the anterior view, is that this long area here of the humerus, this is known as the body or shaft of the humerus. Very important. Now we find here what is known as the medial epicondyle, and you also find a lateral epicondyle. One important thing to notice here, fossa here, this is known as the olecranon fossa. And right beneath it, or a bit more distally, you will find what is known as the trochlea. So this is known as the trochlea of the humerus. Now that we just completed the humerus, it is time to move on to this flat triangular shaped bone known as the scapula, seen here in green. It is also known as the shoulder blade because it is one of the major bony components of your shoulder. Now, in this image here, you can see also two other bones that articulate with the scapula. The first one located laterally, this is known as the humerus, and also superiorly you can find the clavicle. The humerus is articulating with the glenoid cavity of the scapula, and we're going to see and talk about this structure later on in this tutorial. And also it is important to know that the clavicle is articulating with the acromial process of the scapula. So before we go on and define and talk about the different bony structures that you find on the scapula, we need to talk about the borders and the angles that you find on this bone. Now what I have here is an anterior view, also known as a costal surface of the scapula. This is the front part, let's say, of this bone, and I'm going to provide you with the posterior view, or the back side of the scapula, as you can see here on this second image. Now let's first define the angles, and there are two that you need to know. The first one is the inferior angle, highlighted in yellow, and the second one is the superior angle, highlighted in blue. Now once we define these two angles, let's talk about the borders, and there are three that you need to know. The first one is known as the medial border. This is the longest border, and as you can see here, it will extend from the superior angle all the way down to the inferior angle. Now the second border that you need to know is the lateral border, which will go from the lower margin of the glenoid cavity, which is a structure that is articulating with the head of the humerus, that we're going to learn about it later on this tutorial, and goes all the way down to the inferior angle. Now the last one is the superior border. This is the shortest and the thinnest, and will extend from the superior angle all the way to the base of the coracoid process, as you can see here. Now it is time for us to talk about the bony features of the scapula, and we're going to start with the image to your left, and this is the anterior or costal surface of the scapula. Now it's important to notice that here you're going to find a structure that is specific, or specifically seen on, is the spine of the scapula, which is also highlighted in blue. And the spine of the scapula, it's almost like dividing two other important structures that you find on the posterior side of the scapula, and these are the famous acromion, highlighted here in yellow. Now for your own knowledge, I want to tell you that the acromion forms here an angle known as the glenoid cavity, highlighted in green. This is a very important surface located laterally on the scapula, and this surface will articulate with the head of the humerus, as you can see here on this image, and of course a very important articulation happening in your shoulder joint. Now the other structure that you're going to find here is a small projection at the upper border of the glenoid cavity. This is known as the supraglenoid tubercle. And then below the glenoid cavity, you're also going to find another tubercle known as the infraglenoid tubercle. Now you're going to find another structure adjacent to the glenoid. This is known as the coracoid process. And as you can see here on this image, the coracoid process is bent at a right angle, lateral ventrally, and has a flattened tip, as you can see here. Now, another important thing to know about the coracoid process is that this structure, alongside with another structure that we talked about, the acromion, these two will perform a very, very important function, is that they will protect the joint that is found beneath them. And this is a very, very important joint known as the...
So these are the bones that come before the metatarsals and the phalanges, and you can separate the tarsal bones into a proximal and distal group. So in the proximal group, you've got two bones. You've just got this bone here, which articulates with the tibia and the fibula. So it's this bone here. It's called the talus. And you've got the calcaneus. So those are the two bones in the proximal row. The distal row, you've got four bones. So the distal row are the bones of the foot which articulate with the metatarsals. So you've got the cuneiform bones, which are these three bones here. So you've got a medial, an intermediate and a lateral cuneiform bone, which articulate with the first to third metatarsals. And then you've got this bone here, which is the cuboid bone, sitting laterally, and this articulates with the lateral two metatarsals. And then you've got an intermediate bone. So this is a bone which sits between the proximal and the distal rows. So this bone is called the navicular. So I always used to get confused when I was learning about this, because I thought by looking at this lateral view, you can see that the cuboid bone is.
Hi, this is Jack from Anatomy Zone, and in this tutorial we're going to take a look at the tibia and the fibula. And so we thought it's probably best to look at these two together because they're so closely approximated to one another and work together to allow the leg to function. So firstly, the tibia and the fibula form the leg, and remember that we're referring to this in an anatomical sense where the leg refers to that which is from the knee and below. The tibia, which is commonly referred to as the shin bone, is the second strongest bone in the human body, and it carries all of our weight down through and into the foot. Whereas the fibula, which is Latin for pin or clasp, provides much more of a supportive role, so it has a very insignificant role in weight bearing, and in the literature this is stated to be less than 10%. So this has some clinical consequences which are important, and just to note that the fibula provides a great site for bone grafting, because if you remove a bit of the fibula out, then it's not really going to impact on the stability of the lower leg. And secondly, if you have a fracture of the fibula, and this is specific really to those which are in the proximal aspect of the bone and those which aren't really largely displaced, you can actually allow the patient to mobilise as the pain allows without any cast immobilisation. However, the majority of the fibula's role is actually in providing. The fibula is much harder to orientate yourself to, and the only real way to properly do this is actually to get the bone itself and feel both ends or tap both ends. One end will feel flatter, and that's the head, and one end will feel much more pointy, and that's the lateral malleolus. Once you've found the lateral malleolus, then you know that that's the distal part of the fibula, and then what you've got to do is find which way around it is, and what you do to find that is to look for this part here, which is that concave section. And distally it forms this bump here, which is the lateral malleolus. Now that's lower than the tibial's medial malleolus, and that allows actually a little bit more stability to be provided to that lateral part of the ankle. And that's very important because the lateral part of our ankle is very easily injured, and that's commonly seen in ankle sprains where the mechanism of injury is almost exclusively an inversion injury. So intercondylar eminence, which is this raised bit in the middle, this lip in the middle of the tibia. And the intercondylar eminence is important because it allows the attachment of 3 structures anteriorly on it and 3 structures posteriorly. So the tibia, so the anterior aspect of the tibia, you find the bump which is at the top. This bump's called the tibial tuberosity, which is here. And so if you find that, then you know that's the front, and then if you find the base of it, you should find there's a lump at the bottom which is called the medial malleolus, and this faces obviously towards the midline. So in this particular example, this is a right-sided tibia. So this bump which we visited on the front of the bone, which is called the tibial tuberosity, so this provides the attachment point for the quadriceps via the patellar tendon. And just as a clinical aside, the tibial tuberosity can be an important landmark for children presenting with knee pain. So there is a growth plate that develops underneath the tibial tuberosity at 4 to 6 months postnatally, and this fuses at 16 years old. And particularly in kids that play a lot of sports, you can effectively get an overuse injury here, where the quadricep muscle bulk and strength actually overdevelops itself, and so it's pulling against this relatively weak growth plate, and over time that repetitive strain of the tibial tuberosity can cause very small avulsion fractures, which means it's pulling the bone away, and as these repair, the tibial tuberosity grows, so it's enlarged and it's painful. It's known as a traction apophysitis, which goes by the name of Osgood-Schlatter's disease, and this tends to run a course in which it sort of burns out as you become an adult. So next let's just think medial malleolus, which is the most distal point, and that forms the inner portion of the ankle. And so just to add a little bit more to this, the tibia is the commonest fractured long bone in our body.
This video will deal with the ribs and the sternum, which are considered part of the axial skeleton. The sternum is made up of 3 parts. It's the chunk of bone that rides right down the center of your chest. Just under your Adam's apple is a structure referred to as the manubrium. The edge of the manubrium is right about here. So the manubrium is up here on top. Below that, the main part of the sternum, this whole region here, is referred to as the body. And way down at the bottom, this pointy structure is referred to as the xiphoid process. And that basically pokes down into your belly region. The ribs are divided into a few types. You have what are called true ribs, false ribs, and floating ribs. True ribs are ribs that have an individual chunk of cartilage that connects the rib itself to the sternum. False ribs are ribs where there is a shared cartilage. So here there would be 3 ribs that would have merged together into one cartilage that attached to the sternum. And then floating ribs you can't see in this image. They're going to be ribs that aren't attached to any cartilage whatsoever. So this is the rib cage of our natural boned human. Up here we can see the manubrium. Below the manubrium we can see the body of the sternum, and we can just barely make out a little bit of xiphoid down there at the very, very bottom. Concerning the ribs, once again, we have...
Here we are with the ulna, and this is the second bone in the forearm. What we can find, of course, as we always start off with, is to do laterality. Which one's left and right? Because, of course, if you chop off the left arm when you're supposed to do the right, that's a terrible thing. So let's start with using the markings to help us to see what side this bone is. Alright, first of all, let's take a look at this big gigantic notch. As I said, the ulna is one of the bones, very prominent. It always looks like a can opener to me, has this big gigantic kind of notch here. And so let's first start off with this big ball-like structure. This is called the olecranon process. So this whole thing is the olecranon process. Olecranon means elbow, right? Regional terms. So you can imagine that it's always going to be proximal, and of course this would then be the wrist. So we got the olecranon process, and that's proximal. Great. So we got one out of the 3 dimensions. The other one is the anterior or posterior side. And the anterior side is going to be this one that has the actual notch, or this little lip. And this notch is called the trochlear notch. Matches up with the trochlea on the humerus, another condyle, which looks like a spool. And the other one is this little lip here. This is called the coronoid process. Coronoid process. It fits in the coronoid fossa of the humerus again, and again these are both on the anterior side. So now that's nice. I got the trochlear notch. It's also known as the semilunar notch, by the way. Most people actually use the trochlear notch, but regardless, always anterior. So we got the olecranon process, we got the trochlear notch, and then how do we determine medial and lateral? Because of course now it's going to go something on like this if it's on my left hand, or like this, going to be on my right hand. What you'll have to find, and keep in mind, remember that the radius is always lateral and the ulna is always medial. Radial, lateral, ulnar, medial. Radial, lateral, ulna, medial. So you can imagine that the radius is going to be on the thumb side because the thumb is lateral, and then the ulna is going to be on the pinky side. That's one of the things you have to remember, because of course radial artery, thumb side, lateral, ulnar artery, pinky side, medial. Alright, The reason why I say that before I introduce what medial and lateral is because this little notch right here, if you can kind of see, right by the coronoid process is, okay, you see it looks like regular bone, regular bone, regular bone, and then all of a sudden you get this really smooth patch right here where it looked like it would articulate with something. And it does. It articulates with the radius, the head of the radius, that allows it to then spin to do supination and pronation. So that little guy right here is the radial notch. Now, me just saying that should all of a sudden spark brains, cells firing to say radius is lateral. And so this is going to be on your thumb side. This is definitely lateral. And so now I would hold it with my thumb. So this would be my right ulna. So my right ulna. So a couple other markings to be able to describe. We have this little guy right here, this little roughened patch. This little roughened patch, remember, rough is tuberosity, and so this is the ulnar tuberosity. It's the only tuberosity on the ulna, so we call it the ulnar tuberosity. And then, of course, if I traveled not from the olecranon process, but to the distal end, I have the head. So this would be considered the head of the ulna, neck, of course, and then, of course, this little thing called the styloid process. Styloid meaning something that you would write with, like a stylus, for your iPad or for any other types of electronic device, you know, your tablets, your Kindle, your anything like that. You use a stylus. If you still have your Palm Pilot, whatever it is, you take the stylet and you write with it. That is the styloid process of the ulna. And this ulna has, you have to be specific, styloid process of the ulna, otherwise people will think of styloid process of the radius, styloid process of the temporal bone. Either way, styloid process of the ulna, and that is always distal. And now we take a look, let's review. Olecranon process, trochlear notch, also known as semilunar notch, coronoid process, radial notch, ulnar tuberosity, right around here, head of the ulna, and then styloid process of the ulna.
Okay, anatomy students, welcome to our second video that we've ever done here. This is our first video for our new bone unit. As you can see, this is a unit on the cranial bones. Our objective, hopefully at the end of this video, you'll be able to correctly identify all 8 cranial bones. There are 8 that we need to know. So that's a really nice and straight line there. 8 that we need to know out of the 206 bones in the body. So, hey, after today you'll have less than 200 to go. Great. Let's get started. First bone. Let's get rid of those. First bone that we want to take a look at is the frontal bone. It's highlighted here. We see the frontal bone. Also on the front. It's also known as your forehead. Frontal bone. Top of your orbits, top of your eye sockets. Right where your eyebrows would be. It contains sinuses, some of those sinus headaches you feel. First feature that we need to notice is the coronal suture. You see this zigzaggy line right along the top of the skull. When you think of corona, I'm hoping you think of, that's right, an eclipse and the corona going around the sun, I'm sure. That's what we think. It's like a crown going on the top. So we have the coronal suture that connects the frontal bone to the parietal bone, which is the bone right behind it. And there's this little zigzaggy line where the bones have actually grown to each other. Now in infants, when they're born, you've heard of soft spots. It happens because the bones of a baby's head have not fused together yet. They haven't grown all the way. It's due to that way that the bones in your head form. It's not endochondral ossification, but intramembranous ossification, where a membrane that surrounded the brain turns into bone, and we get those soft spots or fontanelles. So we have the coronal suture. Another feature that we want to be able to notice on our frontal bone is the supraorbital foramen. So if orbital is eye, supra must be above the eye, and we see one supraorbital foramen there and another one right there. They're like little holes that you will see on the frontal bone that blood vessels and nerves pass through. Alrighty, so frontal bone. We need to know the coronal suture and supraorbital foramen. Moving on next to the parietal bones. Again, what was this suture? It's called the coronal suture. So for the parietal bones, these are going to form the sides of your head. So either side, top of your skull here. Sagittal suture is what's connecting these two together. Now you should be able to think to yourself, what must be meant by sagittal suture? It's a certain plane that goes through our body. As we look here, this is a top view. Here's our frontal bone. Here is a sagittal, there's a sagittal suture right there. and here's a parietal, and here's a parietal bone. So we're looking right at the top view. You can see how it's all crazy, squirrely in between here, and kind of locking these two together. In class, you'll see that these bones do not come apart. They are pretty well fused together with these sutures. You're in luck. The parietal bones, there are no other features you need to know, just the suture, the sagittal suture. There are 2 parietal bones. Moving on to the temporal bones. Temporal kind of sounds like your temple. This would be the side of your head. You see this weird shaped bone. Okay, temporal bone has a lot of features. So there's 2 of them, one on either side. The first feature, we'll start with the suture. It's called the squamous suture. Oops, let me go back. Squamous suture, and it comes right along here on the side, on both sides. We have a squamous suture. So let's keep going. If you look here on our side view, again you can see the squamous suture right here. They're taking it. There's the bone by himself. You see lots of weird things. I see a bump down here, a little needle part there, and a little bridge going off to someplace. So let's take a look at these. First one is the zygomatic process. Zygomatic process is this little projection sticking forward. It's called the zygomatic process because there's another bone. In fact, this bone right here is called the zygomatic bone. The zygomatic bone touches the temporal bone, and the temporal bone touches the zygomatic. So the temporal bone has a zygomatic process. What would the process be on the zygomatic bone that touches the temporal bone? It's called the temporal process. We move on now to the mandibular fossa. Mandible is this jaw, and the fossa, as we know, are depressions. You can see it right here. It's right by the ear. It's this depression that you're seeing here. It's part of the reason why when we yawn, it sometimes pops our ears. You can hear this kind of popping that goes on when we yawn. Okay. We next start with the auditory meatus. A meatus is more than a foramen. It's like a tunnel. All right. We can see it labeled there. So this would be our ear canal would go in there. Okay. So we have the auditory meatus. You can actually see him coming out on the other side because this is the inside view of the same bone. You can see the internal auditory meatus and the external auditory meatus. Moving on to the mastoid process. When I see the word mastoid, I want to think massive. And that is this big old one right here at the very bottom. This is what's actually going to be connecting your neck muscles. This big, huge muscle that comes down your throat that you use to find your pulse, called the sternocleidomastoid. It's connected to the mastoid process. It allows us to move our head around. Big, huge muscle connects to this big bump on the temporal bone, the mastoid process. Our next point is this little knife point. It's called the styloid process. And when I think of styloid process, I think of stiletto heels. Think of those little pinpoint heels. We can see this little pinpoint thing. It's called the styloid process. It's an attachment point, again, for muscles that control actually your voice box. As you lift up your larynx up and down, muscles are attached to the styloid process. All right? So again, this is the temporal bones. Moving on now to the occipital bone. Only one of them. You see it's on the back of your head. Back of your head. The features that we're going to take a look at here. First is the suture again. It's lambdoid suture. Now you might be wondering, lambdoid, does it have something to do with sheep? It has more to do with this letter called lambda. If we look at what the lambdoid suture looks like, you might notice it kind of has that same shape. Or maybe it's, for some of you guys, it looks like a Mercedes logo here. Almost could be a peace sign. There we go. All right. So we have the lambdoid suture. That's what connects it to what would these bones be here on either side. Hopefully we know. Give you a hint. Parietal with a big P. We then take a look at our features. The first one is the foramen magnum. When I see magnum, I think big again, and that is a big hole. If I flip this bone upside down, you see a gigantic hole right there. Any guesses what goes through the hole? Be your brainstem connecting to the rest.